we start. So can you briefly introduce yourself and talk a little bit about your background?
Yeah, my name is Lasse. I'm a legal advocate with TRAC, so we help low-income tenants are in who are having problems with their landlord, primarily people who are getting evicted. I graduated law school in Denmark around 6 years ago, and I've been in Canada for 3 years, 4 years now.
Right, so we're just gonna go straight into the family doctor situation.
Yeah.
Could you share your journey and some challenges in trying to find a family doctor who could help support your mental health issue?
I have ADHD, or I've recently been diagnosed with adult ADHD around 6 months ago. And I've been trying to, doctors that walk in will refuse to prescribe it because it's a controlled substance, because there's been some abuse of the substance. So currently non-family doctors or won't prescribe it, so every situation goes like this. You walk in, you're like, hey, here's my documents, here's my approval from psychologist, my diagnosis, and they're like, oh, we can't prescribe it unless we're your family doctor. And then you say, well, are you taking any new patients? And they'll be like, no. And then it's like, well, what am I supposed to do? And they're just like, yeah. So that's been feeling pretty frustrated. I think my next step would probably be to try telehealth, like the online doctor.
Oh, you want to try telemedicine or?
Yeah, I've heard it's higher chance to get a family doctor that way, or like someone who can be more consistent.
Oh, I see.
I don't know, but that's the plan.
Because what about seeing like other specialists instead of a family doctor?
Well, you need a family doctor to refer you to the specialists, right?
Oh, I see.
Uh,
Yeah, that's a tough situation actually.
yeah, it's a little bit complicated. Yeah, I've signed up to like all the waiting lists and stuff, but yeah, it's
Still no response?
still no response.
When did you sign
Like,
up?
I mean, you get a response like this doctor's taking new patients, but then you email him. I guess they're getting like hundreds of emails. So far, I've never heard back from any of them, but
I see.
uh,
Yeah. Um.
probably also just because it's like a controlled substance and like they get a lot of scrutiny when they prescribe it. A lot of doctors just doesn't want to deal with it when they have like enough patients, right?
So from your perspective, why do you think there is a lack of family doctors in Canada?
I mean, I think the primary reason is um, both the cost of the education and the lack of education spots. Like, I think there are many possible programs you could do, like where it's like, I think generally, I mean, I think education should be free for all educations, but even if you didn't want to do that, you could incentivize people to take educations that are very beneficial to society, such as nurses, doctors, engineers, or whatever it happens to be in need. Whatever is predicted to be in need, right? Care of senior citizens is going to be a big one. Whatever is in need, when you're sort of doing something that's very needed by society, you shouldn't have to incur cost, right? Yeah, so, and then also open up more spots, because there's like a lot of people who want to be a doctor,
Yeah, definitely.
who can't become a doctor either because they're too poor, or because there are too many spots, so the requirement to get in is too high. Right, so it's sort of like a duality of problems, sort of, and I think that's sort of where the bottleneck starts. And if you're worried about like people getting a free education and then leaving, you can always make it something like, you know, um, you give them a loan, but if you work in Canada as a doctor for 5 years, we'll forgive the loan, right? There are many, for example, many teachers' educations in the States work like that, where if you are educated as a teacher, if you work at a public school for X number of years, then they will forgive your student loans. And you could do something similar here if you wanted to make sure that Canada benefits from educating these doctors. You could say like, okay, well, if you work at a public hospital for X number of years after your education, then we will forgive your student loans.
Yeah, so why don't we talk about Denmark? Do you know the healthcare system in Denmark?
I mean, I've have experiences with it, yeah. I mean, I do think we have definitely, like, you just have a family doctor assigned, like it's part of your registration. Like when you get we have like a national ID, like your BC Health ID. Once you get that, part of getting that ID is choosing a doctor.
Choosing a doctor, so they don't assign you, you choose one?
Yeah, you can choose it within like some sort of, it's usually connected to your address. So like within like 20 or 40 kilometers of your address, you can choose which of the available doctors you want in that area. And I've never experienced that there wasn't any available.
So there's basically no shortage of family doctor, and on top of that, the doctors don't get overworked?
I mean, the rural areas have some problems. Not because there's a lack of doctors, but because no one wants to live there, right? So they have to travel very far to get to a doctor, and especially if you're a senior and maybe you can't drive and you're living in a rural area, and also there's less public transport. It can be difficult to go to and from your doctor. Like it's obviously better to have doctors in the community, but that's sort of like in the media. That's sort of the main topic that's talked about. And yeah, both my cousins are doctors. One is the one that delivers babies, and the other gynecologist, I guess, and the other one is a general practitioner, so a family doctor, and she took over a practice from another doctor who retired like last year.
So it's also free, the healthcare in Denmark?
Yeah, all non-cosmetic healthcare is free. So
including like some prescribed medication?
Yeah, almost all prescription are free. Some have like what you call a deductible.
Okay.
So like the first I think it's the first $500 a year you spend on prescription drugs you have to pay yourself, and then the rest is free, or the rest is covered. It depends a little bit on like how the doctor is prescribing it and what it's prescribed for. There's still some, like mental health coverage is still more problematic than, I mean it's better than here, but it still has some issues, especially with the medication. And then of course also one thing that's famous in the States is that they have like very experimental medicine, like very expensive medicine. And sort of in Denmark it's more of a decision-making process. Like not all of like the most cutting-edge, super expensive treatments are available, because some like there's a sort of like a council that decides like whether or not this treatment is it enough better than the other treatment that it can justify the oftentimes like 10 or 20 times the cost.
How about the wait time?
I mean, there are definitely issues for for some uh, for some operations. It can be a long time, uh, s- but but generally it's quite fast. But especially Denmark has a bad reputation in cancer treatment. So some cancer treatments are very long wait times, and of course it's extra bad that they have a long wait time on cancer because
Spreads.
yes. um, so so that is like, I think that is the main area of problem of like sort of like healthcare in Denmark. Like if I remember correctly, obviously I don't remember the statistics for everything I'm saying, and it has been a few years since I've been back, so I'm not 100% sure on everything, but I do believe like in the OECD countries, Denmark has like the worst outcome for cancer patients. Um, so so but outside of cancer treatment, everything is quite good. Like I think my grandma, to replace her hip, she had like a 4 month wait, which is not very long.
Only 4 months.
Yeah.
About a week ago, I had this opportunity to interview a drama teacher. She had a hip replacement surgery as well, and she had to wait like 2 or 3 years.
Yeah.
And she said she was lucky because she only had to wait 3 years.
Yeah. So, but yeah, but cancer treatment's poor, but in almost every other area,
That's good.
yeah, it's quite good.
Oh,
And it's not. I don't think it's good, but it's not. Just to be clear, like, it's not. Private healthcare isn't completely banned in Denmark.
so it's parallel.
It's parallel, but it's actually a bad system. But because it, like, if you look at the outcomes, it's just worse than the public, like worse and more expensive than, like, every operation in the private sector is worse than the same outcomes in the public.
Okay.
And also, like, what happens is that, like, the private sector, if something goes wrong there, then they go to the public sector. So the private sector doesn't have to sort of deal with like the bad consequences of like a failed operation or things like that. So they get to sort of.
So they're just taking no responsibility?
Generally, yeah, and they will generally only take like the easiest and most profitable operations, right? They won't do like the very complicated surgeries or they'll just do like very standard things that have like a high profit margin, and then charge. The public usually still pays for it, or sometimes insurance, but sometimes the public hospital will also pay for it if like there's this weird thing that like if the wait is too long, then you can go to the private hospital on the public, but the public will pay for it. But yeah, I don't believe in parallel systems.
That's actually a very interesting viewpoint. A lot of the people I interviewed suggest that Canada should have a parallel system with the private healthcare and the public healthcare. Because that way you get more choice, I guess.
I mean, people describe it as more choice, but I mean, I think it's pretty clear what will happen, right? If there's already not enough doctors for the public system, if some of them go to the private, then there'll be even less for the public system, which means poor people will get worse healthcare.
That's true.
Right, like it's not. I think it's dumb to believe that your choices won't have any impact on other people. Like I think you can't just say like, oh, I'm rich, I wanna pay for my healthcare. Why can't I do that? I can understand that as like or like I have company insurance or whatever. It's like, why can't I do that? But it also leads to it also leads to, once you have that, you have sort of like mounting pressure on the politicians to let more and more private private healthcare take over more and more, because there's a lot of profit in it, right? And if the system was good, then America would have good healthcare, but they have the worst healthcare outcomes in general, and they have the most expensive healthcare outcome. Like per citizen, they pay the most, and they also have the worst outcomes when you look at like overall healthcare.
One last question. It's a question that I ask everyone, and it's such a subjective question. On a scale of 1 to 10, how would you rate Canada's healthcare system?
Yeah, I mean, I don't think I have enough um, knowledge to really
Based on your
compare it, but
experience?
based on my experience, I would probably say like 4 or 5. Like I think one thing that's actually like a big thing that I've noticed in Denmark a lot that I haven't really noticed here is that like in Denmark there'll be a lot of like public campaigns for health, like public campaigns to like eat healthier, or public campaigns to wear masks, or exercise, and all of, like very like there'll be posters, there'll be TV commercials, all paid by like the health ministry, right, to encourage the population to be healthier, which I haven't seen a lot of here. Like when I'm on the bus or when I'm on the train or something, I don't see any commercials like, make sure you get like 5 different groups of food in your daily diet, or make sure you consume, right? Like I haven't seen anything like that here, that's probably what drags it down the most for me, because obviously the best healthcare is preventative healthcare. The best healthcare is the one that makes sure you don't get sick. So I think it's weird that at least I don't see from the government perspective like a larger focus on making sure that like the population, like trying to encourage the population to have a healthier lifestyle, or to prevent certain diseases in certain seasons.